Hello, I'm Dr. John Abebe, the Medical Director of the Jode Abebe Fertility Center and the lead tutor at the Jode Fertility Academy. It's my pleasure to be introducing to us the Advanced Fertility Training course for nurses. Or the fertility training course for nurses has three parts. You have the basic fertility training course, then you have the advanced fertility training course, and then you have the practical training program which will take place in the fertility clinic. Now, all students who are going to be enrolling for this advanced fertility training course should have completed successfully the basic fertility training course. Now, the advanced fertility training course for nurses has four modules. You have, and each of these modules have different units. Module 6 has 8 units, Module 7 has 16 units, Module 8 has 4 units, and Module 9 has just 1 unit. Now, the Module 6 is fertility treatment protocols. All right, that is the first module in this advanced fertility training course. We are using Module 6 because we are continuing from the basic fertility training course. And so the first module in the advanced fertility training course for nurses is the fertility treatment protocols. There are various treatment protocols that a couple going through infertility may be subjected to depending on the patient's profile and what the best treatment option that will be needed to achieve results. And so we'll be going through all the various protocols that may be needed or can be used in the fertility treatment of a patient. So from ovulation induction protocols to intrauterine insemination protocols and in vitro fertilization protocols, egg donation, IVF protocols, intracerebral sperm injection protocols, frozen embryo transfer protocols, ovarian reserve test, and protocol for diminished ovarian reserve. And then you have the egg retrieval procedures for patients with azoospermia, meaning that there's no sperm in the semen. So these are all the various protocols that may be needed. And like I said before, it depends on the patient profile and what will be the best treatment option for that patient. And then Module 7, we'll be looking at the skill development in fertility nursing. Now, this module will be looking at all the various skills that's needed by the nurse going through a training program to be developed to be able to provide comprehensive fertility care. So from administration of medications to monitoring and managing treatment cycles in fertility care to patient education, all right, and then semen analysis and handling, and to handling embryology and cryopreservation in fertility laboratory, to communication and counseling skills, to monitoring and assessing patients' progress, to egg retrieval processes in assisted reproductive technology. That is not all. Under the skill development, there are still other units that will be covered. You have embryo transfer in assisted reproductive technology, third-party reproduction, practical skills in intrauterine insemination, the role of nurses in documentation and record keeping, and then ethical and legal consideration in fertility care, preparing for emergencies in fertility care. And then the two last units will be the role of nurses in quality assurance and the continuous learning within the fertility care, and then cultural sensitivity and patient-centered care in fertility nursing. So these are all that will be covered, quite a lot, under the skill development in fertility nursing. And then for Module 8 will be talking about patient care and counseling in fertility nursing. And these will cover areas such as patient care and counseling, emotional and psychological aspect of infertility, communication skills in fertility care, and lastly, we'll talk about the ethics in fertility care. And then the last module for this advanced fertility training course for nurses will be the practical application and the competence development in fertility nursing training curriculum. So that will complete the advanced training course for nurses. So I look forward to meeting with you as we go through this very interesting training program. So see you at the next module on fertility treatment protocols. Have a wonderful day. Bye.